Hi guys, my name is Dr. Joe Brown. I'm going to talk to you today about blood pressure and how to take it correctly. So let me show you how to adequately monitor blood pressure and where to put the cuff, how to put the cuff. Okay, because a lot of people make simple little mistakes on this, and a lot of people are checking their blood pressure at home because they've had a history of heart attack, stroke, or they're concerned because their blood pressure seems to be increasing up, and they're trying to monitor it at home to take care of themselves, but they don't know exactly where to put stuff, and no one's explained this. So let me go over this with you. So I'm going to be showing this. So this is my blood pressure cuff from the office, and if you look here, this says left arm, right arm with a little arrow on it. All right. Now, the first thing that I want to make sure that you guys are aware of is that when you are putting this on, you always preferably want to be using the left arm, okay? Because the left arm is closer to the heart. Remember, your heart is on the left side of your body, which is the reason why we preferably want to use the left arm, not the right arm. If you monitor your blood pressure on the left arm and you get a reading, you can then switch it and do the right arm. That's fine, but preferably use the left arm when you can. Now, what we are wanting to do is we are wanting to keep the arm essentially lateral or extended out and relaxed. So that can be in this position, or you can have it out here, but the bottom line is you just don't want the arm hanging down here to the side because it will alter the reading. Now, if you look here, I have this left arm arrow right down to the center part of the arm here, okay? Because what we want to do is we want to pressurize this blood pressure cuff, put air into the blood pressure cuff so that it constricts down on the arm. And then I'm going to walk you through this here. So let me just do this because I think picture is 1,000 words. So we're going to start by pumping this up here, and I'm going to slide the blood pressure, the stethoscope under the blood pressure cuff, and now slowly bring this down. So the blood pressure that I just got was 118/78. Now what I want you to do is I want you to look at this blood pressure cuff. And if you can zoom in here for a second. If you look at these numbers here, they go in increments from essentially starting down here at 0 all the way over here to 300. Now, if you have anybody that is up here in this upper range here, and I'm going to talk about this in just 1 second, why that's a concern. So on the upper limits of the blood pressure, so let's discuss blood pressure for a second and what the number should be. So if you've watched any of our last videos, blood pressure typically, we like to have it about 120/80. Now that is what textbook says is normal. Nobody is exactly 120/80. And a second ago, when I said on these upper limits of this blood pressure area, if you have any readings in there, that's a concern. So what does that mean? Again, regular blood pressure, we like to have somewhere 120/80. Now, 120 is the systolic number, and the 80 is the diastolic number, because there's always two numbers in blood pressure. The systolic number will fluctuate up and down, and the diastolic will fluctuate up and down. The systolic number, which is the higher number, will fluctuate much quicker and much faster than the diastolic. So for example, I'm walking down the street at night, someone jumps out of the bushes and scares me. My systolic number is going to go up really high, probably for a couple minutes, and then it'll come back down once I realize that that was just my neighbor. Now, the diastolic number might go up a couple points, but it's not going to fluctuate very quickly, and it's not going to go up or down very much, but the systolic will. Now, If you are not exercising and you have a bad diet and you have a chronic condition or you're taking medication for years and years and years, and you are not controlling your blood pressure, for example, the systolic number and the diastolic number will both be going up. And that's what I was referring to, is when you are taking your blood pressure, either with a cuff like this or one of my automated blood pressure machines, which a lot of people purchase at home because they're easier than doing this. Unfortunately, not as accurate, but they are easier to monitor. What happens is that when you have your blood pressure, again, 120/80 or give or take there, your systolic number, or that higher number, can fluctuate from 120, maybe down to 110, maybe up to 130. That's all within the normal range. But once you hit the mark of 140, that is considered high blood pressure. And on the diastolic number, the lower number, once that hits 90, that's also considered high blood pressure, and actually more of a concern than the systolic number. So you are not just looking at the systolic or the diastolic, you need to be watching both and how they're fluctuating, because they tell us if this systolic number is over 140, you need to now pay attention to diet and exercise and sodium and salt intake to make sure that you are decreasing your salt intake and increasing more to get that number to come back down. Because if you don't do it, this number is going to keep rising, and the diastolic will essentially start to rise as well. Now, if the numbers get to 140 to about 160, you need to take a serious look at what you're doing or not doing. Because if you don't have a heart attack or stroke within the next few days, weeks, or months, you're going to if you don't change what you're doing. Because you're putting yourself at like an 80% risk anytime you are above that 140 to 160 range. Now, if your numbers on your systolic number is above 160, so now you're climbing up to 165, 170, 180, you need to get into the doctor or the emergency room ASAP, because the chance of you having a heart attack or stroke is off the charts. Last part of this video I want to leave this with is on that diastolic number. When the diastolic number starts going up, remember, the diastolic number is usually somewhere around 80. Now you start getting up to that 90 range or above, you are at direct risk for a heart attack, stroke, cardiovascular problem ASAP. Okay? So diet, exercise, salt intake, avoid canned foods, frozen foods, things with those higher salt intakes or sodium on the labels. And also the fluctuation of the range. So if you have a low systolic number or a high or low diastolic number, that can also mean a problem. So don't just think that my blood pressure is high, that means it's a problem. If your blood pressure is low, that's also a problem. Now remember, if your systolic number is below 100, so because doctors always talk about, you have high blood pressure, let's put you on medication. They never talk to you about diet, exercise, or nutrition. Yes, all of that works, but nobody ever talks to you about, well, what happens if my systolic or diastolic numbers, especially systolic, is low, lower than 100. Drink more water. It means you're not getting in enough fluid into your body, and that is the reason why your systolic number is coming down. And when it comes down, you are at very high risk of wanting to stand up and you pass out on the floor. And you wake up to 911 looking at you in the face, you're giving you CPR. So it's not just high or low blood pressure, it's both. So I'm Dr. Joe Brown. I wanted to just cover a couple quick tips on high blood pressure, where to take it, what to look for if you're using one of these cups, and what to do if it's too high or too low. If you have any questions or comments, leave it in the area below. I'm happy to answer your questions. Again, I'm Dr. Joe Brown. Have a good day.